The Minister of Health, Dr. Sage Hanire, has called on religious and traditional leaders to study their doctrine and stop the harmful practice of female genital mutilation so as to avoid infringing on the girl child's rights. He made the call at a high-level launch of a movement for good to end FGM in Nigeria, the nation's capital, on Thursday. Dr. Hanire said this practice has continued to be unabated due to certain beliefs, hence the need for all to revisit our doctrine to avert the health consequences associated with genital mutilation. According to a global report, Nigeria has the highest cases of female genital mutilation, which account for about 115 million out of 130 million circumcised women worldwide. However, it is also said that 77% of other women have the highest prevalence practice in Nigeria, as the Southeast Zone accounts for 68%, Southwest Zone 65%, while other parts of the country are involved in the practice with a limited rate. This is why the Ministry of Women Affairs and Social Development, in conjunction with the United Nations International Children's Emergency Fund (UNICEF), has organized this event to build an ambassador of 5 million Nigerians movement for good initiative to act to end this ugly practice. While speaking, the Health Minister, Dr. Sage Hanire, calls on well-meaning Nigerians to galvanize support both materially and financially across the board to eliminate female genital mutilation activities in the country.
The movement for good to end FGM in Nigeria calls upon us and stakeholders to step up investments to end this practice in Nigeria. If we stop or rest in our investment, we shall allow this practice to continue unabated. It is therefore a moral duty to increase material and financial support to eliminate this harmful practice.
Earlier, the Minister of Women Affairs and Social Development, Pauline Talin, while citing the country's 1999 Constitution in Section 12 and the Child Rights Act 2003, stresses that female genital mutilation is a punishable offense by law, thus harping on the need to ensure implementation to discourage the practice.
The Child Rights Act of 2003 in Section 11b states that no child shall be subjected to any form of torture, inhuman or degrading treatment, end quote. The Violence Against Persons Prohibition Act 2015 is indeed a variable weapon in this crusade. This recommends that a person who performs female circumcision or genital mutilation or engages another to carry out such acts commits an offense punishable by 4 years imprisonment or a fine of 200,000 or both. Our problem is not just domesticating the VAP Act or the Child Rights Act, but our problem now is the implementation of these laws. We must rise up to the occasion through our state houses of assemblies, with our governors, our traditional rulers, and religious leaders to ensure that these laws are implemented.
On her part, U.S. Ambassador to Nigeria, Mary Beth Leonard, stressed that its government has been committed to ending female genital mutilation in Nigeria, hence assuring unwavering support to ensure zero tolerance to the practice.
Design our foreign policy with the rights and needs of women and girls in mind. Our policy is more effective, more humane, and more likely to make a lasting difference in people's lives. And when we support women, we can help foster change on a much broader scale, because it is often women doing the hard work to make that change happen. And proudly reaffirm the United States' commitment to continue in our shared struggle to end female genital mutilation.
Experts say female genital mutilation has no health benefits, rather endangers women with different kinds of diseases, which include sexually transmitted disease amongst others. Vincent Okushi, QTV News, Abuja.